Next one is cardiogenic shock. This cardiogenic shock is simply pump failure. That means the heart is not able to pump the blood efficiently to different parts of the body, and the heart has the normal volume of the blood, but the heart is not efficiently pumped because when the heart gets contract, the blood pumps out of the lungs to different part of the body. But in case of cardiogenic shock, there is a pump failure, there is a contraction failure due to some cardiac emergencies in some disease conditions, which may be leads to cardiogenic shock. And what is happening in this cardiogenic shock is that blood pools in the left ventricle and back up into the lungs, which leads to pulmonary edema and decreased cardiac output. That means when the heart is not able to pump the complete blood out from the heart, this blood get pooled in the heart and it is pumped back in each. The order is that, um, the circulation order is that, um, the blood from the upper part of the body collects by the superior vena cava, blood from the lower part of the body collect from the inferior vena cava. These both superior vena cava and inferior vena cava collect deoxygenated blood, that means oxygen poor blood, to the right atrium. From the right atrium, blood reaches to the right ventricle. From the right ventricle, through the pulmonary artery, this blood reaches to the lungs, and in the lungs the oxygenation happens, and after oxygenation this oxygenated blood bring back to the left atrium. From the left atrium to the left ventricle. From the left atrium, aorta is originating, and this aorta pumps oxygenated blood from the left ventricle to different parts of the body. And in case of cardiogenic shock, this normal cycle is not happens, and blood pools back to the left ventricle. That means through the from the aorta, this blood aorta is not able to pump blood, so this blood is pulled back into the left ventricle. From the left ventricle, then again to left atrium, and from the left atrium to the lungs. When the lungs pulmonary artery leads to pulmonary edema and decreased cardiac output, because all the normal cycle gets affected, which leads to lack of blood to tissues. When there is a proper oxygenation, or for the proper oxygenation, there should be adequate blood supply. If the blood is not supplied to tissues adequately, there is a lack of oxygen also, which leads to hypoxia. When there is a hypoxia, the cellular metabolism gets impaired, which leads to impaired cellular metabolism and low. Already said that when there is heart is not able to pump blood to different parts of the body, there is a low cardiac output. When there is a low cardiac output, there is which leads to um, low blood pressure also, because there is the vascular resistance gets decreased, because the heart is not able to pump blood out of the heart. And what are the causes of cardiogenic shock? First one is the myocardial infarction or myocardial ischemia. That means already we know that there is a lack of oxygen supply to the myocardium, or lack of blood supply to the myocardium due to some thrombus or atherosclerosis, or there is a thrombus, which leads to myocardial infarction. In such cases also, the complication is cardiogenic shock. And in cardiac tamponade, pulmonary embolism, myocarditis, left-sided heart failure, these are the conditions which leads to cardiogenic shock. This we can study detailedly in another class. And the main symptoms include, we can remember as hypotachy. Hypo means hypertension, tachy means tachycardia, and next tachy means tachypnea. Already there is a low cardiac output which leads to hypertension. When the heart is not able to pump complete blood out of the heart tries to contract more, which leads to tachycardia, because heart tries to contract more to pump out this blood out of the heart. So which leads to tachycardia, and the patient experience rapid weak pulse. And next is tachypnea. Tachypnea means fast shallow breathing, because when there is a hypoxia, there is accumulation of or there is a increased carbon dioxide production. So body or lungs tries to expel out the increased carbon dioxide from the lungs. So the patient experience tachypnea to the experience at the symptom as fast shallow breathing. Next one is diaphoresis and cool and clammy skin. So this is indicates that there is a inadequate blood supply, which leads to cool and clammy skin. Next one is arrhythmia. Arrhythmia means there is a contractility rate is increased when the heart tries to contract more to pump out the blood, which leads to arrhythmia, mainly ventricular arrhythmia. Arrhythmias of that is also we have to learn in detail. Next one is jugular venous distension. That is already we said that the blood is pumped back to the left ventricle, and left ventricle which leads to the pulmonary artery blood flow, which leads to pulmonary edema, also which leads to right-sided heart failure also. In right-sided heart failure, the patient experiences jugular venous distension. And how we can treat this cardiogenic shock? First one, we have to support the heart. As the heart is not able to pump efficiently, we have to support the heart, and we have to treat the underlying cause. When in which condition which leads to cardiogenic shock. For example, we already said myocardial infarction, cardiac tamponade, pulmonary embolism, myocarditis, and left-sided heart failure. And we needs to these disease condition needs to be treated properly, so that only we can control the cardiogenic shock. And in case of MI, there is a PCI or CABG. PCI means percutaneous cardio intervention, or CABG means it is a surgery, that's the bypass graft surgery. And in case of pulmonary embolism, the thrombolytics. Thrombolytics usually administered to dilute the clot. And tamponade, there is a accumulation of fluid in the cardiac muscle. So in such cases, pericardiocentesis. Pericardiocentesis means drain out the excess fluid which accumulated in the pericardium. These are the main things which we have to remember in cardiogenic shock. We will get many questions this cardiogenic shock, and they may ask in any way. So we have to thoroughly understood. We need to be thoroughly understand the normal circulation, and what is happening. This normal circulation gets affected. So next I will tell. Next class I will tell about the cycle, our blood circulation.